Have you ever felt like the health industry is overflowing with promises, but the real answers always seem just out of reach? Red light therapy has become one of the most talked about wellness trends, with claims that it can heal injuries, reduce chronic pain, boost energy, and even reverse the signs of aging. But behind all the buzz, there's a deeper, quieter story, a story filled with questions that aren't always easy to answer. Is this therapy truly the breakthrough it's made out to be, or is there more to the narrative that's being overlooked? What's real, what's exaggerated, and what are they not telling us? It's time to shed light on the truth about red light therapy, because understanding it could change the way you see your health forever. Think about how overwhelming it feels to navigate the world of health and wellness. You try to make informed decisions, but it's like every new solution comes with more questions than answers. Red light therapy is a perfect example. It's celebrated as a breakthrough that can heal injuries, relieve pain, boost energy, and even rejuvenate your skin. But for every glowing review, there's skepticism, and it's hard to know what to believe. And for those specifically looking into red light therapy, the problems start piling up. First, there's the overwhelming amount of conflicting information. How does it work? Does it actually penetrate deeply enough to make a difference? Then there's the question of accessibility. Some devices cost hundreds, even thousands of dollars. Are they worth the investment, or are you better off visiting a clinic? And what about the science? For something that claims to help with everything from chronic pain to anti-aging, why does it feel like solid answers are so hard to come by? But it's not just about the therapy, it's about trust. How do you decide what's worth your time and energy when the information is so fragmented? It's like the more you search for answers, the more the full story seems out of reach. When it comes to red light therapy, it feels like there's something deeper, something we're not being told. And that's the problem we need to unravel. To understand red light therapy and its potential, we need to dive into the science behind it. Red light therapy, also known as photobiomodulation, PBM, involves exposing the skin to low levels of red or near-infrared light. These wavelengths, typically between 600 to 900 nanometers, penetrate the skin and are absorbed by the mitochondria, the energy-producing structures in our cells. Unlike UV light, which can damage DNA and increase the risk of skin cancer, red light is non-ionizing, meaning it does not harm cells but rather promotes healing and regeneration. The process begins with the absorption of light by a molecule called cytochrome C oxidase, a key component of the mitochondrial electron transport chain. This absorption increases the activity of the mitochondria, boosting the production of adenosine triphosphate, ATP, the energy currency of the cell. When cells have more energy, they can perform their functions more efficiently, including repairing damage, reducing inflammation, and promoting tissue regeneration. Several studies have demonstrated the effectiveness of red light therapy in accelerating wound healing. A 2017 review published in Seminars in Cutaneous Medicine and Surgery highlighted how PBM stimulates the production of fibroblasts, the cells responsible for producing collagen and extracellular matrix, both essential for skin repair. This makes red light therapy a promising option for post-surgical recovery, burns, and chronic wounds. Inflammation is a common underlying factor in many chronic conditions, from arthritis to autoimmune diseases. Red light therapy has been shown to reduce markers of inflammation in both animal and human studies. For example, a 2018 study in Lasers in Medical Science found that red light therapy reduced inflammatory cytokines in individuals with chronic joint pain, leading to improved mobility and reduced discomfort. One of the most well-documented uses of red light therapy is its ability to alleviate pain. Research published in The Lancet in 2009 analyzed 16 randomized controlled trials and found that low-level laser therapy significantly reduced pain and disability in patients with chronic neck pain. The mechanism behind this is thought to involve the reduction of oxidative stress and an increase in endorphin production. Athletes are increasingly using red light therapy to enhance recovery and performance. A 2016 meta-analysis in Frontiers in Physiology reviewed 46 studies and concluded that PBM improves muscle recovery, reduces exercise-induced muscle damage, and enhances overall performance. The therapy works by increasing blood flow and reducing oxidative stress, which allows muscles to recover faster after intense activity. Emerging research suggests that red light therapy may also benefit mental health and brain function. A 2019 pilot study in neuropsychiatric disease and treatment found that PBM improved symptoms of depression and anxiety in participants, likely due to its ability to enhance mitochondrial function and reduce inflammation in brain cells. There is also evidence that red light therapy can support cognitive function, particularly in neurodegenerative diseases like Alzheimer's. One major issue with red light therapy is the variability in results across studies and individuals. Factors such as the wavelength, intensity, duration of exposure, and the specific condition being treated can all influence outcomes. For instance, wavelengths in the 630 to 680 nanometers range are more effective for superficial skin issues, while those in the 800 to 850 nanometers range penetrate deeper tissues. Despite decades of research, there are still gaps in our understanding of exactly how PBM works on a molecular level. While the role of mitochondria and ATP production is well established, other mechanisms, such as its effects on oxidative stress and nitric oxide release, require further investigation. Home devices for red light therapy can range from $200 to over $1,000, making them inaccessible to many. Clinical treatments can also be expensive, with costs adding up over multiple sessions. This raises questions about affordability and whether the benefits justify the investment. The lack of standardized protocols is another concern. With so many devices on the market, it can be difficult for consumers to know which ones are effective and safe. Some products may not deliver the appropriate wavelengths or intensity required for therapeutic effects, leading to disappointment and wasted money. Red light therapy has undeniable potential, backed by a growing body of scientific evidence. It offers a non-invasive, drug-free approach to addressing a wide range of health concerns, from pain management to skin rejuvenation. However, it's not a magic solution. Its effectiveness depends on the specific condition being treated, the quality of the device, and the consistency of use. More large-scale, high-quality studies are needed to fully understand its mechanisms and optimize its application. For those considering red light therapy, it's essential to approach it with realistic expectations. Consulting a healthcare professional and ensuring the use of clinically tested devices can help maximize its benefits. While it's not a one-size-fits-all solution, red light therapy represents an exciting frontier in health and wellness that's worth exploring. If you've ever felt like prioritizing your health is selfish or unrealistic, it's time to let go of that belief. Taking care of your body isn't just about you, it's about the energy you bring to the people and the world around you. Imagine what life could look like if you woke up feeling energized, clear-headed, and free of the pain that's been holding you back. That's not indulgence, it's survival. It's thriving. Red light therapy isn't about chasing trends or gimmicks, it's about giving your body the support it needs to function the way it's meant to. And while no single solution works for everyone, what if this is the key you've been searching for? What if it's the small, consistent change that helps you break through those barriers and finally feel like yourself again? You don't have to keep putting your health on the back burner. This is your chance to invest in the person you're meant to be, and not just for you, but for everyone who depends on you. I know change can feel overwhelming, but it doesn't have to be. Start small. If you're curious about red light therapy, begin by researching devices or clinics that align with your needs. Look for clinically backed products that offer the right wavelengths and intensities. Maybe your first step is trying a short session to see how your body responds. Integrate it into your routine gradually. For example, if you're looking to improve your skin, start with 10-minute sessions a few times a week. If your goal is pain relief, consider using it post-exercise or after a long day. Each small, consistent effort adds up, and over time, you'll start to notice the difference. And don't forget the basics: hydration, a balanced diet, and quality sleep. Red light therapy works best when it's supporting an already healthy foundation. Think of it as a tool to enhance your journey, not a shortcut to skip the work. You're here because you believe in your potential, and I want you to know that I see that. Thank you for giving yourself the time to learn, to grow, and to become the best version of you. You deserve it. Every step you take, no matter how small, is a step closer to thriving, to living the life you've always envisioned for yourself. If this message resonated with you, share it with someone who might need to hear it. Together, we can create a ripple of health and happiness. You've got this, and I'm rooting for you every step of the way.